Greetings, it's New Zealand naturopath Eric Bakker, author of Candida Crusher and formulator of the Candida range of dietary supplements. Thanks for checking out my video. We're back again talking about SIBO. This time we're going to look at the signs and symptoms of a small intestinal bowel overgrowth or SIBO infection. So there are many different signs and symptoms, and this is a problem that in fact some recent research in the US has found that between 6 to 15% of the population in fact have some kind of SIBO problem. And it remains really undiagnosed. Up to 80% of people with irritable bowel syndrome have got SIBO as well. And probably the reason why it remains undiagnosed is because a lot of people suffer from gas, from bloating, from reflux and burping, from constipation, diarrhea, from abdominal discomfort, and they'll put it down to booze, drinking too much alcohol, or having pizzas or chicken burgers or whatever kind of food that some people eat. So many people put it down to that. So these symptoms are very, very common, and they're actually a functional complaint. So they don't really create a lot of pain in your life. They don't create a lot of problems, financial problems or relationship problems, or gas can sometimes create some relationship problems, but I think you get my point. It's not really a life-threatening problem. And that's why a lot of people don't even go to the doctor who have SIBO. And for that reason, it remains largely undetected. So what are some of the typical signs and symptoms we would see with SIBO? Well, abdominal discomfort is one. When you're going, you've got to loosen your belt after you've had a meal. Gas is a very common one. And so passing gas is quite normal. I mean, we all know that. And a lot of people make fun of it. But some people actually have got it really bad, terminally bad, so shocking. So, bloating, abdominal distension, so that pain, or what we call incarcerated flatulence, or gas pockets bubbling away inside. Sometimes you'll feel it, and another term for that is called medically called bulbarismus, or bulbarismus I think is the term, or like gas or something, feeling like something's actually alive in your abdomen moving around. It's usually gas. Diarrhea and IBS-like symptoms like constipation or diarrhea are quite common. Anybody with irritable bowel syndrome will know all about inconsistent bowel motions. They did research in England years ago on irritable bowel and found that over half of all cases were stress-related, which is quite interesting. Constipation. Constipation is so common in America, it's incredible. Many people follow still the SAD diet, or the standard American diet, and the bowel turnover is approximately every 3 days, or every 72 hours, which is not very good. Over half of the patients I see from the US, in fact, don't pass bowel motions every day. They pass every second or third day. That's pretty unhealthy. So you really want to be looking at improving your diet, but particularly improving your bacteria in your gut to facilitate a better transit time. You'll find incredible improvements occur when you get that transit time improved. So belching, lots of burping. And you'll notice that some people are always belching or taking peppermints or mints and things like that. So in more severe cases, we're going to get weight loss and appetite issues with that. And what you'll also find long term, some of the signs and symptoms of SIBO also will be fatigue and sleeping disorders, and also cognitive dysfunction and mood swings these people will have. Because once you start messing around with the bacteria in the gut, you're going to get a lot of problems with production of folic acid and B vitamins and vitamin K, for example. You could even get bone disorders and many other long-term ramifications of having poor digestive health. So if you look back in Ayurvedic textbooks in medicine and the Chinese medical books, going back thousands of years, the digestive system is really the center of the person's well-being. And you don't have to be a rocket scientist to work out that if you've got a poor digestive function for many years, you're going to have a very poor health overall. So it really pays to improve that. So the next video we're going to do will be on testing for SIBO. What tests are available and are they accurate? We'll catch you in that video. Thanks for tuning in.